Click to add the title. That is okay. Dear friends, good morning. So we'll continue with our earlier session, that is family planning and family welfare. So now in this particular session, we'll focus on the contraceptive methods. Which are the contraceptive methods which are commonly used? And what we are going to talk in today's session, I'm going to highlight those methods which are very commonly used in India, in our country, and in fact they are used in so many other parts of the world also. But you will find in Europe and other more developed countries some specific methods they are using. Probably we are not using those methods in India right now. But I will just touch most of the methods which are commonly used. Now here, before even I start my session, I want to make you aware about one thing. Many times that word we use it in the medical terminology, cafeteria choice. What is a cafeteria choice? Cafeteria choice means you go to any cafe, tea shop, coffee shop. What you do? You make an order. You want the ordinary tea, or you want masala tea, you want ginger tea, you want some other kind of tea, herbal tea, various varieties. You have a choice what you want to take. Go to a coffee shop, you will ask whether Mysore coffee, whether it is Meghalaya coffee, whether it is Pur coffee, whether it is filtered coffee, brew, Nescafe, whatever. So many varieties are there. You have a choice. What you like, you take it. Same concept now legally been promoted in choosing the contraceptive devices. I already told you, it's an individual choice. Now government says, health authorities are saying, doctors are saying, we are not going to force you to do this, that, do this, don't do that. We are not going to force you. There is no force, there is no compulsion, but we are giving you a choice, which is a wider choice like a cafe. So this is called as a cafeteria choice. So what I mean by cafeteria choice, I'm just going to mention here few those methods of cafeteria choice. Choice is given to the mother. Choice is given to the husband and wife, the couple, what they should choose. Duty of a doctor, a medical person is to explain to them what is good, what is right. These are the advantages, these are the disadvantages. This is suitable for you, this is not suitable for you. So we tell them all methods, we tell them all advantages, disadvantages, and we ask them to choose. See here, the consent is very important. Consent part is very important. That is a voluntary concept. Those days are gone. Now we cannot force the couple or the mother, please do this. That's all. It's not like that. You have to explain them, educate them, and let them decide. So now here we are going ahead with that. What is this we are going to do? Here I'm going to mention all these which are package and part of the cafeteria choice. First and the foremost, they are in two groups. What are two groups? One is the spacing methods. First, in the foremost, spacing methods. Then, last method is the terminal methods. Terminal methods are actually to stop your family life or the reproductive cycle itself. Terminal methods, there is no reversal, but choice is worse. So first we'll go for the spacing methods. So what are the spacing methods which are commonly used in India? Most of the gynecologists offer these methods. First is barrier method, second is intrauterine devices, third is hormonal methods, fourth is post-conceptional methods, fifth is miscellaneous. Barrier methods. What are barrier methods? Which are those methods? Barrier methods are physical barriers. Chemical methods are chemical barriers. Combined methods are both physical as well as the chemical. They work simultaneously together and in close. That is a combined method. Then intrauterine devices, hormonal methods. So I will go in detail about these spacing methods. See here, you can see an overall overview picture of contraceptive methods available. I think some of you are familiar, have seen this picture somewhere. Have you seen it in your family planning tray? Have you seen it in your labor ward? Have you seen it in a family planning center or postnatal OPD or any mothers or women's clinic? Maybe you must have seen all these gadgets itself by yourself. You must have handled them. But now I'm just going through it for your purpose so that you understand what it is. It is one picture, so many methods have been given, the contraceptive methods. First is the barrier method. What is shown here is a condom. Second barrier method is, you can see the last diaphragm or the cap. Okay. Then vaginal down. That is also another method. So these are the, we call it is commonly the barrier methods. Now, even the female condom is also the barrier methods. Now we'll come to the hormonal contraceptives. Which are those hormonal contraceptives very commonly used? You can see the oral contraceptives. That one strip here. Then hormonal ring. Oral contraceptives are nothing but the pills. You can see it in the market, Maitri, Saheli, Mala, Nirvaya, so many pills, so many brands, varieties of the brands are there available in the market. So these are the oral contraceptive pills very popularly used by the Indian folks, Indian women. They are nothing but the low concentration of estrogen and the progesterone combined in a such a way. It is combined in a such a way the fertilization does not happen. Fertilization is prevented itself in the beginning. So conception don't happen. Fertilization don't happen, the conception don't happen. And this oral contraceptive method is very popular because it doesn't have any complications of intrauterine devices at all. But at the same time, it is very easy to consume. It is like a small pills every day you have to consume at proper time daily. Don't consume them when you are in the menstrual cycle. Very easily you can take these. Any uneducated lady or very busy or occupied lady can also use it. So its convenience is unparalleled as far as the oral contraceptives are concerned. Remember, this very widely used by the women, young married couples, and in the later stage also. But remember, once you stop the use, then there is no guarantee that the pregnancy will be prevented. There is no guarantee. And the second important aspect, if you are taking oral contraceptive pills for 10 years, 20 years, 30 years without going for any terminal method, then you are taking the hormones for a long time and you can have some kind of a hormonal toxicity or the problems in terms of, it has been found some of the malignancies in the women, particularly breast cancers or genitourinary, any malignancies have a relation with the overconsumption of the hormones. So we have to be very careful. It should not be given permanently forever for the span of 20 years, 30 years, 40 years. That is not advised, but it is very convenient for newly married couples or the young lady for her to follow the oral contraceptive or the hormonal pill. Now we'll come to the another. What is that another which is very commonly used is the intrauterine devices. Very, very commonly used is the intrauterine devices, particularly after the first childbirth. We, most of the gynecologists or the health workers suggest please use intrauterine devices because that is a very ideal way of inserting the IUD, which can remain for the period of 3 to 4 years or 5 years, may not cause any kind of harm to a lady, and very popular use. I'll come to that, which are the IUCDs which are using. Then contraceptive injections. I spoke about the contraceptive hormones tablets. Same tablet can be used in the form of contraceptive injections. These injections are given once a year, maybe 6 months. One injection in 6 months, maybe in a 3 month span, depending upon what concentration you are using. It saves the trouble of taking the tablet every day. So these are the contraceptive injections. Advice for the women for whom taking oral contraceptive pills may not be very easy. Then there are another contraceptive pills contain those hormones. There is something called as, now you don't take injection also, you don't take oral pills also. We'll give you something else to solve your problem. What is that thing? Implant. What is the implant? Subdermal subcutaneous implant of the hormones, where slow release of hormones happen, and it can be implant. That implant lasts for 2 years, 3 years, 4 years, 5 years, depending upon the concentration of hormones in that implant. Very popularly used, particularly in the Western countries, because they don't want to use the IUCDs or they don't have time to take the oral contraceptive pills. Then comes another methods, which are not using any drugs as such. What is that? Coitus interruptus, one way. Rhythm method, using your calendar, the rhythm method. Then contraceptive patch, that is again contraceptive patch is also again a contraceptive hormonal method. So remember this, these are the some barrier methods which are also very commonly used. And the last and the foremost, here you can see, that is a surgical sterilization. Surgical sterilization for male sterilization and the female sterilization. So terminal methods, here you can see male sterilization, female sterilization. Now we'll come to the little bit in detail about the barrier methods. Which are those barrier methods? Physical methods. Which are the physical methods? I already mentioned, we saw it in the picture. The condom, male condom, female condom. See the picture, see the diagram, how it looks. The condom, the diagram, female condom. Vaginal sponge, how these are used. These are used as a barrier methods of contraception. Diaphragm also you can see. Diaphragm is not so easy to insert actually, but still it is used. The next here you can see the vaginal sponge. So vaginal sponge also is many times actually medicated. It contains some of the hormones also. So vaginal sponge are also very commonly used, not so commonly used in our country, but it is used very commonly in the Western country. Now comes the intrauterine devices. Intrauterine devices, can you see here? See the picture clearly. Which are those devices? I already mentioned you types of IUCDs. First generation IUCD, then lipase group. Second generation IUCDs. Advantages of copper devices. Third generation IUCDs. That will go into the detail. What is first generation, second generation, third generation? But see here, long-acting birth control options. Which are those options? Our all-time favorite is copper intrauterine devices, up to 10 years, 99% effective. Hormonal IUCDs, 3 to 7 years, 99% effective. The implant is up to 3 years, 99% effective. Short, up to 3 months, 94%. This is not intrauterine method, but it is injectable method. Then the ring, again a barrier method, up to 21 days, 91% effective. Patch is about 7 days, it is effective, and it is 91% effective. So in this picture, you can see long-acting birth control options, various options is there. The shortest option is patch, which works for 7 days. Longest option is, you can see here, is copper IUCD, which works almost for 10 years. Remember this. Now, what changes have happened? Our first generation IUCD was very favorite was the Lipis loop or U loop or double S. Lipis loop is double S shape loop. Now we are not actually using the Lipis loop. That was a first generation IUD. Lipis loop. Second generation IUDs are mostly the favored copper devices. So you can see the copper IUCDs here, various either T shape, L shape, Y shape, various shapes. This copper IUCDs come into the picture. Third generation IUD series. Third generation IUD series are hormonally implanted. They contain the hormones. They are not only the barrier method, but they contain the hormone also. That is third generation IUD series, and they were continuation for 3 to 7 years. Mechanism of IUD series. What is the principle? How IUD series work? What is the basic mechanism? Is it the medication? Is it the hormones in the IUD series? What is that? First and the foremost, you will find most important advantage of IUCD is the effectiveness indicator. Effective for a long period of time, starting from 3 years to 10 years is a long period. That is the most important advantage. Change of IUCD is advised. The moment the couple wants a child, you remove the IUCD and it is guaranteed in the span of couple of months or year the couple will conceive the child. Change of IUCD should be also easy, smooth, without any harm to the mother. So these are the certain advantages of IUCD. First, it is long acting, long lasting, easy to insert. Then you can change, you can remove the IUCD also as per the will of the mother. These are the biggest advantages, particularly in Indian situation where woman can forget taking the pills every day or she doesn't want injectable methods. This is the best choice. What are the contraindications? Contraindications is the you have to first find out whether she is suffering from any intrauterine infection, abdominal infections, is she prone for some kind of other infection, whether she is already immunocompromised or she is suffering from some kind of other elements, or you can find the IUCD is not retained. Every time you insert, it is expelled. So these are certain contraindications that you have to keep it in the mind. The ideal IUCD candidate is the one who has given first birth to the child and is able to understand your guidelines and is very cooperative, and the uterus accepts the IUCD, it retains, and the mother is also comfortable without any side effects. And the timing of insertion, as most of you know, after the birth, we always call the mother to come for the insertion of the IUCD immediately after the birth, and the follow-up. The follow-up is done once IUCD. Many Indian women who are seen in our OPDs, they forget the IUCD is there only. So you have to remind, you have to tell her that IUCD is there. You have to come after 2 years, 3 years, 4 years. She has to decide and she has to come. It should not happen that mother has forgotten about the IUCD being inserted. So those things you have to actually first is the timing of insertion. You should be careful. You should be careful about the follow-up also. Side effects and the complications. What are the side effects of the IUCDs? Here, the list of IUCDs in any variety or any category. What is that? First is bleeding per vaginum, very common. Pain in abdomen or the lower abdomen, frequent pelvic infections, unnoticed or without any pathogenic reason. Continuously, the mother is suffering from the pelvic infection. That is one thing. Uterine perforation, leading to bleeding or some kind of other problems, or IUCD is found in the floating in the abdomen. That is also formed. That is because of uterine perforation. Then comes, what is the side effect? Pregnancy. Pregnancy may happen when you have inserted the IUCD, but where the pregnancy will happen, it will be the ectopic pregnancy leading to a emergency or acute condition that is called as a ectopic pregnancy, another complication. Even if it is not ectopic pregnancy, a pregnancy can also happen, uterine pregnancy, and it will be literally very difficult to remove the IUCD that time. Then what is the another disadvantage? Expulsion. I already mentioned. Some of the uterus don't accept the IUCD, so expulsion. Then the fertility after the removal. Some of the mothers or the couples complain after removing the IUCD, they are not conceiving the child. Maybe for few years, few months is all right, but few years they are not conceiving. So that is a big problem. So that is the fertility after the removal. Then cancer and the teratogenesis. Cancer and the teratogenesis is particularly seen in case of hormones or hormone containing IUCDs, not otherwise. Hormonal contraceptives which are very commonly used. Gonadal steroids. Which are those gonadal steroids commonly used? Oral pills, which I already mentioned, very popular, very commonly used. Second, preparations, depot formulations or depot preparations, which are slow release injectables, which are given. So these are the basically gonadal steroids. Gonadal steroids are given as a part of contraception, and easily it can be given and implanted. How it is given? First is the oral pill. Which are the oral pills are in different category. Combined pill, progestin only pill, that is POP, post-coital contraception, once a month pill which can be taken only once in a month. You don't have to take every day like a combined pill. Then the male pills. Male pills are basically the androgens which they take, and it has got a very higher concentration. So basically we don't advise the male pill as such, but you should be aware such pills are also available. Then mode of action of oral pills, effectiveness, risk, and the benefits. First, mode of action. I have already mentioned, it contains the gonadal hormones. It basically prevents the fertilization and implantation of a fertilized ovum in the uterine cavity. The fertilization itself does not happen because the ovulation also does not happen. In case also ovulation happens, even then the fertilized ovum is not actually properly implanted in the uterine cavity. First action. That is the effectiveness. Almost 99% oral pills are definitely they're effective if they are taken regularly. But the problem here is the regularity. Pills are effective, but if you are not regular, you are not understood the proper timing, how to take it, then the effectiveness of the pills also wanes. It becomes very difficult. Then comes the risk and the benefits. So you have to now consider here, what are the risks associated with the oral pills? What are the benefits? Decide depending upon the risk and the benefits what should be done. Now, what are the adverse effects here? Adverse effects are cardiovascular effects, carcinogenesis, metabolic effects, other adverse effects, common unwanted effects. These are the
side effects of oral pills.
the side effects of the oral pills. Here you can just see in the picture what is very commonly, I said, very popularly used method all over the world, even in India. Our mothers or the young ladies who are married, they like to take these common things, headaches, nausea, vomiting, bleeding per vaginum, bleeding between the periods, that is intermittent bleeding. Then comes the breast tenderness of the pain. So these are some of the side effects. What are the beneficial effects? Just see. That's what I said. You have to first see what are the side effects, then what are the beneficial effects. You have to see the pros and cons of the both the sides. What is better? Beneficial effects, when you see, you have to see contraindications when you should not use the oral pills. First is the contraindication. Duration of the use. For how long you should use? IUCD can be there for years, 3 years to 10 years. You can't ask a lady to take the pills for a period of 10 years, 20 years like that. It's a contraindication. So duration of the use. Give the specific duration, which should be a shorter duration in between the two pregnancies, and there should be a medical supervision. If you do that, then definitely it is a very beneficial. It has definitely added beneficial effects. Then comes the depot formulations. Oral depot formulation are the injectable contraceptives, which is very commonly used injectable contraceptive, progesterone only injectable. So here you can see POP, that is progesterone only contraceptives preparation. Progesterone only preparation is POP. Here you can see injectable. You can see the syringe and you are taking it from your vial. Depo Provera contraceptive injection, very commonly given 150 mg per ml. It's given usually. Usually we are not giving it to for the primary or a woman who has not delivered a child, but we are giving it to a woman first indication that she cannot take the intrauterine preparation. For many contraindication for the intrauterine preparation, she cannot even take the oral pills daily. It's difficult for her. Then what is the immediate option? Is the Depo-Provera, where you have injectable contraceptive can be given and it is effective for almost 6 months to 1 year, depending upon the duration that you have to decide what is the age of the lady, what hormone she can take, what should be the preparation, what should be the concentration of the hormone, whether she can take it. So it is very effective. Once a month it can be once in 6 months, or you have to see the periodically her condition. Then comes next to POP is DMPA. NATN is again hormonal preparation. DMPA is also hormonal preparation. DMPA SC 104 mg. So these are all injectables. All injectables. They are very commonly used, particularly in the Western world. It's very common and very popular. Here also in India, we are giving injectable, but we are actually giving it for the mothers who can come and do the follow-up regularly, and they remember the timings of injectables, that timetable, and they can follow the all the precautionary measures. Next comes the combined injectable contraceptives. Which are those combined injectable contraceptives? That is subdermal implants. They are contraceptives, but we are using it as a subdermal implants. Then we are using it as a vaginal rings also. Again, they are like hormones, but they are used as a implants. One is subdermal and one is vaginal. So that's third class. Just show me the slides. That is why in the nutrition also I want more